Every life lost to breast cancer is a story of untold strength and unmet potential. This October, as we mark Breast Cancer Awareness Month 2025, we're not just raising awareness, we're amplifying the voices of millions who faced this battle, survived it, or lost loved ones to it. The theme this year, "Every story is unique, every journey matters," isn't just a slogan. It's a call to recognize the vast differences in how breast cancer impacts lives globally, and a reminder that no one should face it alone. But here's where it gets controversial. Why do survival rates still depend so heavily on where you live? Let's dig into the facts, the challenges, and what we can all do to make a difference. Breast cancer isn't just a health issue, it's a human one. In 2022, over 2.3 million women were diagnosed worldwide, and nearly 670,000 lost their lives to it. These aren't abstract numbers. They're mothers, daughters, friends, and colleagues whose stories deserve to be told. Yet survival rates vary wildly, 90% in high-income countries, but only 40% in places like South Africa. And this is the part most people miss. These disparities aren't random. They stem from unequal access to early detection, timely treatment, and affordable care. If we don't act now, global breast cancer cases could rise by 40% by 2050. That's not just a statistic, it's a crisis waiting to deepen. To tackle this, the World Health Organization, WHO, launched the Global Breast Cancer Initiative, GBCI, in 2021. Think of it as a blueprint for change built around 3 pillars: health promotion, early detection. Imagine a world where every woman knows her body and recognizes symptoms early. The GBCI aims to ensure 60% of invasive breast cancers are caught at stage 1 or 2, when treatment is most effective. Timely diagnosis. How long should it take to get a diagnosis? The answer should be now. The goal is to reduce diagnostic delays to under 60 days for all patients. Comprehensive treatment. Surviving breast cancer isn't just about finding it early. It's about getting the right care. The target? 80% of patients completing their full treatment plan, no matter where they live. But how do we turn these targets into reality? The GBCI isn't working in isolation. It's building partnerships across governments, healthcare providers, and communities. And this October, the focus is on action, sharing stories, training healthcare workers, and pushing for policy changes. For example, the Global Storytelling Campaign invites survivors, advocates, and even policymakers to share their experiences via videos, podcasts, or social posts using the hashtag #EveryStoryIsUniqueToo. Why does this matter? Because when we hear real stories, we stop seeing breast cancer as a distant problem and start seeing it as a shared responsibility. Here's what you can do to help. Share your story or amplify others. A single post or video can inspire thousands. Host an event in your community, whether it's a screening drive, a webinar, or a simple conversation about early detection. Advocate for change. Push for policies that make breast cancer services accessible to all, regardless of income or geography. Support local organizations through donations or volunteering. This October, let's challenge the status quo. Let's ask tough questions. Why do survival rates still vary so drastically? What can we do to bridge the gap between wealthy and low-income nations? And most importantly, how can we ensure every story of courage, resilience, and hope isn't drowned out by statistics? Share your thoughts below. Agree, disagree, or add your own perspective. Together, we can build a world where no one's journey with breast cancer is defined by where they live.